Hello, everyone. This is Mr. Alan again, and tonight we'll be having another Facebook Live on nursing prioritization and delegation. So, everyone, if you're available, please join me because tonight we'll be having some new questions that I'll be presenting to you for our nursing delegation and prioritization questions. Okay, so so for tonight, I have prepared several questions, and this will really cover the most important strategies that you need to know in order to answer successfully questions on delegation and prioritization. Okay, so please participate, especially my students in the online NCLEX Academy. I am so excited to see your responses. And again, if you want to have your images posted in the comment section or in the video, just click the link so that your picture will appear. Okay, so so tonight I'm going to discuss a few questions as what I have said. So please join. Okay, so we have a few people who's already here. We have Frezel. Hi, Frezel. How are you doing? Nice to see you here tonight. Excited to see you. Okay, so another one we would like to welcome. Hey, Marella, how are you doing? So Marella is supposed to join us tonight, but then maybe we can do that next time. Okay, then we also have Janelle. So Janelle, nice to see you as well. So I think the last time you also joined our Facebook Live prioritization delegation. Okay, and then also we have Kim. So Kim is also here. She's our student for the or in the online NCLEX Academy. Okay, so join me tonight, everyone, as we tackle some of the questions that you may encounter probably in your NCLEX. The most important lesson for tonight is not memorizing the question, but knowing the principles and the strategies behind answering the questions, especially when you talk about delegation and prioritization, because these are the kind of questions that you will encounter in the NCLEX. Okay, as a review, remember that your NCLEX questions are designed to meet the analytical and the application skills of new nurses or graduate nurses. So you always have to remember that we have the Bloom's taxonomy of learning, and that's the basis for the kinds of questions that you will encounter in the NCLEX. Okay, as what I have said, even in my book, the most common questions that you will encounter will be in the application and analysis level. So you have the remembering question, you have the understanding questions, and then you also have the application and then analysis. And these analysis questions, okay, the difficulty level, are the questions that will make you pass your NCLEX examination. So again, a big chunk of your NCLEX exam are going to be questions on delegation and prioritization. So you really need to master this. And also a lot of students have been emailing me as well that they really want to master delegation and prioritization. So that's why I'm creating this Facebook Live, especially for all of you graduates and nurses to master this, because this is the real world of nursing. Um, in the clinical practice, you will be dealing with assignments, with delegation, and also with prioritization. Okay, so let's proceed to our first question for tonight. But before that, let's welcome some students that we have. We have Pratiksa. She's our student also in the online NCLEX Academy. And then also we have we also have Mai also. She's here for tonight. Okay, so thank you very much for being here again. Okay, okay, so we have a greeting from Presla. She said, "Good sir, thank you so much." Okay, and then hi sir. So this is Dayan. Dayan is my student before, and of course I'm very happy to see you here in the Facebook Live tonight. Okay, so feel free to join me, everyone. This is going to be an exciting session for all of us. All right. So let's go and proceed to the first question for tonight. Okay. Hi, Joyce. You're also here for tonight. Thank you very much. Okay. And then also Induka. Nice to see you here also. Thank you. Okay. So please participate and put your answers in the comment section, please. Okay. So the first question for tonight. Okay. So we have a question which is all about prioritization, and here the question is all about laboratory. Okay. one of the most common questions that you will encounter in the NCLEX will be questions about laboratory results, and then what will be your appropriate nursing action based on the laboratory results. So you have to go to the NCLEX exam knowing that you will have questions on laboratory results. And this is the cornerstone of our practice. We need to make sure that we know our laboratory numbers and results and the implications of the lab results. So that's the number one thing that you have to remember when you get your NCLEX exam, okay? Make sure that you know your laboratory results, not only memorizing the numbers, but really knowing in which disease conditions they are present, what are the implications, and what are the corresponding nursing actions, okay? So the question is, the charge nurse in the medical surgical unit is reviewing the laboratory results of a client and notes the following values. So number one, RBC is 5 million cells per microliter. Sodium is 137 MEq per liter. Albumin is 4 grams, and calcium is 7 milligrams, and a WBC count of 8,000. So which of the following is a priority nursing action? A, call the healthcare provider. B, continue to monitor the client. C, implement neutropenic precautions. Or D, administer oral calcium gluconate. So what do you think is the answer to this question? Okay, so if some of you are here tonight, please give us your answer and we'll post that, okay, in the comment section. What do you think is the answer? So when you answer this question, you really have to make sure that you analyze each laboratory value, okay? Don't be hasty. Do not rush. You really have to look at each value, and then you have to decide if they are normal or abnormal, okay? So what do you think is going on, okay, in this value? Which ones? Analyze each number, all right? Find out if they're abnormal or normal. Okay, so let's have some people give your answer, everyone, so that we can flash the answers also. Okay, so what do you think is the answer to this question? Okay, so let's see. All right, so in this question, the answer is going to be, all right, so most of you, what do you think is the answer, everyone? So let's analyze the question. So number one, you have to realize that RBC of 5 million is considered to be normal, okay? And remember that there are different lab values for female and males in terms of RBC, but an RBC of 5 million is acceptable, okay? Sodium of 137, what is the normal sodium level first, everyone? What's the normal sodium level? Okay, what's the normal sodium level here? Normal sodium level is 135 to what? 145 milliequivalents per liter of blood. So your sodium and your RBC are considered normal in this situation. Okay, your albumin is 4 grams per deciliter, and you don't really know if that albumin is normal. Okay, that's actually within the normal range, the albumin level. Now the calcium is 7 milligrams per deciliter. So remember that your calcium is somewhere in the 8 to 10 milligrams per deciliter. So this is a little bit low, your calcium. And your WBC is 8,000. And what is the normal WBC count, everyone? The normal WBC count is 5,000 to 10,000. Okay, that's your normal WBC count. So if you look at all of these values, okay, the only one that is abnormal is your calcium, which is a little bit low because the normal is 8 to 10 milligrams per deciliter. Okay, so a lot of nurses, when they look at this question, they see the WBC right away and go back to your WBC count. What is the normal? 5,000 to 10,000. So when you really have labs in the NCLEX, you have to analyze each lab value, okay? Just don't choose an option because you think that that is something that is always abnormal in the practice questions that you have answered, okay? So because the normal sodium level, very good, Mateo, the normal level is 135 to 145, very good, all right? And yes, of course, that's the normal value. Fresel, that's correct as well, 135 135 to 145. Now, looking at this, you know there's nothing wrong with the WBC. It is not low, it is not high. So the answer here is not going to be letter C. It is not implementing neutropenic precautions. Okay? Be very careful about that in the NCLEX, because a lot of questions that you always encounter is to implement neutropenic precautions. But in this situation, you don't implement that because it's 8,000. So in the NCLEX, okay, you're always having biases or prejudices. Okay? So make sure you really analyze the laboratory result. Okay, do you call the healthcare provider? Not really. Okay, we continue to monitor the client, or letter D, administer oral calcium gluconate as ordered. So remember, this patient is having a calcium level of 7 only, right? So 7 only is the calcium level of the patient. So the best answer to this one is going to be letter D. This is the answer in this situation. Why is it letter D? Because the calcium level is only 7. It's not highly critical though, because that is not a critical value, because the normal value of your calcium is 8 to 10. So you have to give the calcium of the patient. And maybe after that, you have to call the healthcare provider just to let him know, or to notify the healthcare provider that the calcium level is low, which is 7 milligrams per deciliter. Okay, or because it's already ordered, or another option is to really look at some of the other orders wherein it pertains to the calcium management of this patient. So the answer for this is going to be letter what? Letter D. Okay, so the answer is going to be letter D. Yes, administer the oral calcium gluconate as ordered. It's already there. So that's the first priority that you need, because the calcium level is only what? Is only 7. Okay, so it's not highly critical, but then you still have to give the calcium, and then you report the laboratory. Okay, so that's the answer. It's going to be letter D. Very good, because of the low calcium level. Okay, all right. So low calcium level. So we also have Joyce. Thank you very much, Joyce. Okay, thank you for the appreciation. I really appreciate that. Okay, so let's remove that question and let's go to the next one. So remember that your laboratory, okay, I always tell students, when you answer a question in the NCLEX, you have to slow down a little bit, okay, and really read the situation. Be very careful. Every word matters in the NCLEX. And when you answer NCLEX question, you always have to think that every question will be the most important question. There's no less important question in the NCLEX. There's no more important question in the NCLEX. So when you sit down for the NCLEX exam, you really have to concentrate on every question and treat that question like it's the most important question. Because remember, in the NCLEX, you're being scored based on your overall performance. Okay? So don't be lazy thinkers. I always tell that to my students, because there will be a point wherein when you're sitting down in the NCLEX, you feel tired, you know, so you really have to lift up your spirit and make sure that no matter what happens, okay, when you sit down and answer questions in the NCLEX, you're giving it all right? And that's why you have to come to the NCLEX exam not only mentally ready, you have to be physically ready. You need to have enough sleep, you need to have food. If you need pain relievers, that's also very important, okay? Because when you sit down for the NCLEX, don't expect that you will be answering only 60 or 75 or 85, the maximum or the minimum. Rather, expect that the computer may give you hundreds of questions, and you really have to answer the question very well each time. All right. So let's go to number 2 question, everyone. Okay. So for this number 2 question, so this question is about delegation. All right. So let's check your skill on delegation. All right. Or assignment. Okay. There's a big difference between delegation and assignment. Okay. Especially with delegation. Delegation means that you're passing on the responsibility, but you are still accountable. Okay. So the nurse is assigning several clients in a medical surgical unit. Which of the following clients should the nurse assign to a newly licensed nurse? And this is a very common situation in the NCLEX, wherein you have a new graduate nurse, and then what will you assign to the new graduate nurse? Of course, remember, if it is a new graduate nurse, less experience means that you're supposed to assign or delegate a very stable patient, the most stable patient. Okay, so is it A, the 20-year-old client was a flail chest due to a car accident? B, the 30-year-old client who has a fever of 102.1 degrees Fahrenheit due to pneumonia? C, the 50-year-old client who is vomiting and has generalized abdominal pain? Or D, the 60-year-old client who recently underwent a colonoscopy procedure? Okay, so if you're sitting down now in the NCLEX and you're answering this question, what do you think will you answer? Because definitely you will receive questions like this. How do you identify the most stable client for the newly graduate nurse? Okay, one of the techniques is to make sure that you're not delegating someone who has ongoing complications. Okay, ongoing complications. So the answer will be, someone said, okay, what's the answer for this? Who do you think is the most stable client in this situation? Okay, is it A, B, C, or D? So someone answered letter D. That is Julie. So Julie said it's letter D. Okay, why do you think, Julie, letter D is the answer? Okay, then we also have uh, Nadisha, also Joseph. Okay, you also answered letter D for this one. Okay, now, so let's find out the answer to this question. Okay, but before that, let's dissect the question carefully. Okay, so for number two, remember that letter A, you cannot assign that to the newly licensed nurse because, again, you have to go back to your content. What is a flail chest? A flail chest represents fractured ribs. You know, when you have paradoxical chest movement, and that indicates this patient is having a chest injury and, of course, respiratory issues. So you don't want to assign that to or delegate that to a newly licensed nurse, okay? Because that is an unstable patient. Flail chest. All right. So now again, when you're answering this in the NCLEX, if you don't even know what flail chest is, there you go. So you don't know that it is a priority. So vocabulary is very important. Letter B, the 30-year-old client who has a fever of 102 due to pneumonia. Remember, this is an ongoing problem, pneumonia with fever. So you should not assign that to the licensed nurse, okay? So maybe you can, but then you have to look at the other options because there is probably a more stable patient, okay? So letter B is an unstable patient. There's fever going on, okay? Letter C, a 50-year-old client who is vomiting and has generalized abdominal pain. So you have to use the process of elimination. Letter C, you have to look at that vomiting and general abdominal pain. Something could be going on with the patient. It could be appendicitis. It could be intestinal obstruction. So the safest client that you can assign is going to be someone who is a 60-year-old who recently underwent a colonoscopy procedure. So this is the answer, everyone. That's going to be your letter D. D is the answer in this question. So remember that, everybody, okay? Letter D is the answer. Now, if there's any other options, maybe that's more stable, like a client with, for example, let's change the question. A client with a new diagnosis of diabetes, or let's say just a heart failure, or a client who has had a chronic heart failure in the facility for a while. So maybe that's a more stable patient, okay? Not really the new diagnosis patients. It could be that patient may need some health teachings, okay? So letter D is, you may say, oh, this is unstable because just underwent a recent procedure. But then, again, in the NCLEX, you have to look at the four options. Which one is the lesser of all of this? You know, the lesser evil of all of this. Among A, B, C, and D, you have to look at the situation. D may be unstable because, okay, you say it's a recent, you know, colonoscopy. But remember, there's not any other information with letter D. So the answer is going to be D because you have to look A, B, and C. They are the most unstable. But D is probably more stable patient after colonoscopy. You have to look at A, chest injury, B, pneumonia, C, that would be vomiting, and letter D is just a patient who underwent colonoscopy. So the answer is going to be letter D, everyone. Okay, so some people answered letter D, very good. Okay, so most of you got that. Okay, so in the NCLEX, you always have to remember that you have to use the process of elimination. Okay, because maybe somewhere in the past you answered letter D as an unstable patient, and that's okay. But maybe there is a different situation during that time. But then when you look at the situation, A, B, and C have complications ongoing, especially pneumonia with 102. Okay, so that's going to be fever. The patient needs to be monitored. Okay, and then letter C and also letter A. Okay, so let's now go to the next question, everyone. Okay, so our next question is going to be on, okay, on, I think this is prioritization. Okay, so prioritization, everyone. So a client in the surgery waiting room tells the nurse that she forgot to indicate in the interview form prior to surgery that she has an allergy to certain sedative medications. Which of the following should the nurse do next? Okay, A, document the allergy in the electronic record. B, report the allergy to the surgical staff. C, reassure the client that sedatives do not cause allergy. Or letter D, review the client's advance directives. Okay, so in this situation, what do you think will you do? Okay, hi Fulake, how are you? It's nice to see you, Fulake. Okay, I really like your picture. Nice to see you, Fulake. Okay. All right. So this is a situation wherein you have allergy, and we know that allergy is a serious situation, right? Especially with our patients. So what do you think? Okay, will be the answer in this question? Okay. So someone answered, Nicole. You answered letter B. Report the allergy to the surgical staff. Okay. Who else has another answer? Okay. What do you think is the answer for this one? Ralph, you also answered letter B. Okay, very good. Okay, who answered letter B? Ray, also letter B. Okay, report the allergy. Okay, are you not going to review the client's advance directives in this situation? Okay, so let's proceed and dissect this question, everyone. Okay, all right. So in this situation, everyone, you have to remember, okay, that this is a client who is about to have surgery. All right. And this client said, oh my gosh, I forgot I'm allergic to certain sedative medications. Remember that one of the preoperative medications of patients, if they're about to have surgery, is going to be your sedative medication. So at this point in time, we don't know what kind of medication the patient is allergic to. Okay, so what do you think are we going to do? Okay, so the answer to this question is going to be letter, okay, it's going to be letter B. Very good. B is the answer to the question. Congratulations. Okay, some of you have had your answer here. Let me see. Show the answer. Okay, B, you answered letter B. Okay, Mars, you also answered letter B. Very good. B is the answer. Why? Using the process of elimination, you can do letter A, but you have to do that later. Okay, reassure the client that the sedatives do not cause allergy. That is a big mistake because sedatives are medications as well, and they can cause allergy in some patients. D, review the client's advance directive. Okay, at this point in time, there's no need to, there's no relationship between reviewing the advance directive, unless you don't know what an advance directive is, and then you'll be like, okay, so let's review the advance directive. So maybe you can say review the client's chart, all right, or the documentation, but not advance directive, because advance directive doesn't really have anything to do with this information. Okay, but the first thing you have to do, this patient is about to have surgery, is to inform the surgical staff about the situation, and also try to clarify the information if there is really a miscommunication, if there is a failure on the part of the patient to report the allergy. Okay, so this is very important, especially that this patient already signed the consent for surgery. Okay, so let's proceed to number 3 question, everyone, or number 4 question. So number 4 is going to be again delegation. So as what you know, we have had a lot of delegation questions in our prior Facebook Live, because I really want you all to be experts in delegation, okay? And one of these days, I'm holding a free webinar on delegation and prioritization again, okay? So there's something about delegation and prioritization that I'm very passionate about, because I think that this is the core of our practice as well. Especially as nurses, we wear many many hats in the clinical practice. So it's priority. So let's proceed with this question, everyone. So this question is about delegation. Okay, the registered nurse works together with the licensed practical nurse, or LPN, and the unlicensed assistive personnel, UAP, in the unit. Which of the following responsibilities would be appropriate for the RN to delegate? A, assign the LPN to hang intravenous multivitamins and saline. B, ask the UAP to observe and document clients' food intake. C, request the LPN to turn every 2 hours a client with stage 3 pressure ulcer. Or D, instruct the UAP to stay with the client a few minutes after the blood transfusion is started. So what do you think is the answer to this question? Okay. All right. So is it A, B, C, or D? Okay. So this is delegation of assignment to the staff. So you have your LPN and you also have your UAP as well. So what do you think is the answer? Okay. So in this situation, let's dissect the question. So some of you answered letter, let's see, some of you letter B. Okay. Document the client's food intake. All right. You also have letter B, Nicole as well. Okay. Then you also have, okay, Mars, also letter B. Okay, very good. So most of you actually answered letter B in this situation. Okay, so why do you think is letter B the answer? You're all correct. The answer is going to be letter B. Very good. So let's show the answer, everyone. Okay, so the answer to this is going to be letter B. All right, so always remember letter A, assign the LPN to hang intravenous multivitamins and saline. We all know that that is not the scope of practice of the LVN or LPN. They cannot hang IV medications, okay, but maybe saline, you know. But then remember, in some states, in order to hang intravenous fluids, the LVN must be certified. Okay. Letter B, ask the UAP, or letter C first, request the LPN to turn the patient every 2 hours. You know, a client with stage 3 pressure sore or ulcer. Yeah, that would be okay, you know. But then, however, that turning the patient every 2 hours is something that a UAP can do, not really the LVN. Unless you have, again, a shortage of staff in the unit, then you can answer letter C because the LPN has to help out. But in the situation, you know, the LVN or LPN does not necessarily have to turn patients every 2 hours. Okay. Letter D, instruct the UAP to stay with the client a few minutes after the blood transfusion. You don't want to do that because you know that reactions may happen after a blood transfusion and you cannot assign UAP in this situation. Okay. So the correct answer is going to be letter. Okay. That would be letter Okay, B, very good. Hi, Christian. How are you doing? So Christian is my student before in the actual live NCLEX review class, and he already passed the NCLEX examination. So thank you very much for being here tonight, and hopefully one of these days you can be my guest in the Facebook Live so that you can talk and share with your fellow graduates or nurses how you prepared for your NCLEX and how my review program has benefited you or has helped you in passing your NCLEX exam. Okay, so thank you. All right. So the answer for this is going to be letter B. So because documenting the client's food intake is within the scope of practice of the UAP or certified nursing assistant in some other states. Okay. All right. So let's have another question, everyone. Okay. So this question is all about, okay, another one is going to be assignment, or it's going to be delegation again. All right. So delegation. So let's see. So the licensed practical nurse informs the charge nurse, okay, that she got pregnant. Which of the following clients should not be assigned to this nurse? Okay. All right. So pregnant nurse should not be assigned to which patient? A, the client with copious draining wound due to a stage 4 pressure sore. B, the client who recently received a vaccination for shingles. C, the client with advanced prostate cancer who has a radium implant. Or D, the client who has an exacerbation of systemic lupus erythematosus or SLE. So which client cannot be assigned to a pregnant nurse in this situation? Okay, who do you think? Okay, So put your answer in the comment section, everyone. What do you think is the answer in this situation? Okay, is it A, letter B, letter C, or letter D? You have to go back to your concept. Okay, which nurse or which patient cannot be assigned to this nurse? Okay, so let's dissect the question, everyone, on what's going to be the answer in this question. Okay, all right. So in this question, you have, okay. So most of you actually answered what letter? It's going to be letter C. That's correct. Yes. So letter C is the answer. It seemed like everybody knew the answer right there and then. Okay. But then again, I would like to remind everyone that in the NCLEX, be very careful. Okay. C is the best answer, obviously. But then you really have to read A, B, and C, and D. So let's just, for the sake of just really using the process of elimination in the NCLEX, let's have the following. So A, the client with copious draining wound due to a stage 4 pressure sore. And you'll be like, oh, okay. So I don't think I will assign a pregnant woman to someone with pressure sore. Maybe there's infection going on, right? Letter B, the client who received shingles vaccination. Okay, and you'll say, oh, shingles. Remember, letter B, it doesn't mean the patient has shingles. Okay, so if the patient has shingles and the pregnant woman has a negative titer for chickenpox, then maybe you cannot assign that, letter B. But it doesn't say anything about having shingles at this time, right? Letter D, the client was SLE. Remember, SLE, even though there's an exacerbation, is a non-infectious disease. So there's no danger of any viral infection there. So that's why letter C is the answer because of what? Because of radiation. Sweat cell. Okay, so sweat cell is actually my student in the school. Okay, very good. So you're part of my online academy or my Facebook group as well. And then also Ralph. Ralph is my student right now. Okay, and the answer is letter C. Okay, very good. So all of you got the correct answer, everyone. It's going to be letter C. Okay, at the end of the day, okay, you have prioritization questions, but my advice is always read the question, everyone, very carefully. And I would encourage you as well to go back to my other videos because we had some prior questions also. Again, the most important thing here is not memorizing the question, but knowing the principles behind answering prioritization questions. Okay, and again, always remember when you are prioritizing, you always have to look at the most unstable patient, and most unstable patient usually will have the signs and symptoms of major complications that you know. Okay, so really look at that. All right, and in the NCLEX also, it doesn't matter if a patient is male or female. That has nothing to do with prioritization and delegation. Okay, that has nothing to do. The most important consideration to find out if the patient is stable or unstable is to determine, okay, what signs and symptoms the patient have and what is the possible complication or condition that is present. All right. So that is a short review for tonight. And then next week, we'll have another Facebook Live, everyone. Okay. And I hope you learned something tonight. But again, before I end, I would just like to share again, my program, which is the Matus Nursing Review online NCLEX Academy. So we do offer different programs like the different webinars. So right now we have the ongoing 10-week fast track live NCLEX review every Tuesday, and then also an upcoming 8-day live NCLEX review webinar as well. And I do have a lot of students in the self-study comprehensive review program. Okay, and they do have a workbook that they can use while reviewing in the NCLEX review. Okay. Another one, I do have a published book in Amazon as well. And this book is something that a lot of my students have been giving compliments because they really like the simplicity of the book and it's really easy to read. And it's just a matter of 2 days, 3 days, you will finish the book and it's really very easy to read and the layout is really very good. And I would like to thank the students, everybody who participates in my program. Without you guys, I will not be here. Okay, so I'm doing this because I'm very passionate of what I do and I really want to help out students. And we do have some programs that are coming up in order for students to really prepare for the NCLEX very well. Okay, our goal is to make everything as simple as possible. I'm not going to give students 10,000 questions to study because that's not the way you prepare for the NCLEX. Okay, the best way is to study hard, but you have to study smart, everyone. Okay, so buy my book in Amazon. It's going to help you a lot. And if you like the book, feel free to leave or write a review in Amazon, everyone. Okay. So let's have just some comments here. Thank you very much, John. Okay. So thank you for being here tonight. Frizzle, thank you very much also for being here again. Okay. And keep on studying everything, guys. Prepare for your NCLEX. And then also Marella, thank you. Okay. Thank you for being here tonight. Okay. So, and then also, who are the other people? So we have Induka. Thank you also for being here. So we have a lot of people. So I have to stop putting the faces in the comment section. Okay. So thank you very much, everyone. And feel free to enroll in my online NCLEX Academy program. It's very affordable. It's only $49 per month. Thank you very much, everyone, and have a nice night.